What are the signs and symptoms of cystic fibrosis? Babies may have digestive issues with very frequent fatty poos. There may not be immediate signs of any problems, and so coming to terms with the diagnosis can be difficult for parents and families if newborn screening identifies a child who may have cystic fibrosis. If treatment is started at the earliest opportunity, the baby can be kept as well as possible for as long as possible and delay the appearance of symptoms. When symptoms do show up, they might include a persistent cough, infections in the chest, and/or poor weight gain due to the trouble with absorbing fats. To manage these issues, a combination of medicine and physical therapy, those are special exercises and techniques for clearing the airways, can help control lung infections and they can prevent damage to the lungs. The pancreas is an organ in the body that produces juices that help us digest the food we eat. In most babies with cystic fibrosis, the tiny channels these juices travel through get blocked by thick mucus. This means the body can't digest and absorb the fats properly. To help with this, babies can be given enzymes that help break down fats during the feeding. A dietitian would be able to explain this in more detail if needed. Using these enzymes does not affect breastfeeding. Chest issues. Normally, we all have some mucus in our lungs to help them work well, but in babies with cystic fibrosis, the mucus is thicker than it should be, and this can clog up the smaller airways and lead to infections. To stop this from happening, babies may be started on preventative antibiotics, and parents can be taught about ways to clear the airways through a technique called chest physiotherapy. Being physically active is a big part of caring for cystic fibrosis, and it's encouraged from a very early age. Physiotherapists will explain this in more detail when they meet with families. Bowel issues. Sometimes babies with cystic fibrosis might show signs of a bowel blockage within the first few days of being born. This is called meconium ileus. Surgery might be needed to remove the blockage, but in some cases it can be managed without surgery. About 8% of people with cystic fibrosis might face blockages in small liver ducts. While it's not common, it can be serious, and all children with cystic fibrosis receive regular monitoring for liver problems. Bone strength. Children with cystic fibrosis are more likely to have weak bones due to problems related to their condition. This can cause issues in early adulthood, so it's really important to focus on eating well and staying active to keep the bones strong. Longer-term issues include the possibility of affecting fertility. Men might have blocked tubes that carry the sperm, while women with cystic fibrosis can still produce healthy eggs. Nowadays, many people with cystic fibrosis go on to become parents.